Assalamualaikum everyone, welcome back to Chai and Clinicals. Today we're going to be covering breast surgery. Okay, so the basic anatomy of breast is that it lies vertically between the second and the sixth rib. And if we talk about the medial relations, medially it's associated with the lateral border of sternum, and laterally it's going to be till the point of either anterior or middle axillary line. Breast is also associated with an axillary tail, which is called as axillary tail. It is sometimes mistaken as a mass of enlarged lymph node, or a breast mass, or a lipoma. So it could be misunderstood as lipoma, enlarged lymph node, or a mass, and it increases in size during premenstrual phases. So after the periods, the size of it would decrease and the woman would not be able to palpate it. Now, breast is divided into its parenchyma and supportive tissue, right? So the breast parenchyma, major side parenchyma and supportive tissue. The parenchyma basically has a terminal duct and also lobular unit also. So this is together called as terminal duct lobular unit. It is the most active part of breast, okay, and it is the part which is responsive to a lot of hormones. So it would be responsive to estrogen, progesterone, prolactin, and even growth hormone. So all of these hormones. Alongside with that, all of the diseases, like 50% of the diseases, arise from terminal duct lobular unit. Alongside with that, all of the diseases are going to be basically arising from terminal duct lobular unit, and 50% of these would be from the upper outer quadrant, the area where most of the masses are found. Then about the supportive tissue, it's going to have fibrous tissue. Alongside with that, there is also going to be adipose tissue, blood vessels, and lymphatics. In fibrous tissues, we're going to be talking about the suspensory ligament of Cooper, which is basically attached to the dermis of the breast and the pectoral fascia. It provides support to it. Alongside with that, the areola and the nipple region of the breast is going to have circular and longitudinal muscles. Both of these are actually the involuntary muscles. The circular muscles are going to be the Sapi's muscles, which play an important role in erection of the nipple. And then they are also called, the longitudinal muscles are going to be called as Mayer-Holtz muscles, which play an important role in the retraction of the nipple. So Sapi for the erection part, and then Mayer-Holtz for the retraction, and also that this is longitudinal and this is circular. So you can also learn it with the mnemonic of CSE and LMR. Then there's also going to be axillary lymph nodes. Axillary lymph nodes are divided in 3 levels, 1, 2, and 3, and all of these 3 are in relation to pec minor. The one which are going to be below and lateral to it are called 1. The second one are going to be level 2, which is going to be behind the pec minor. So these are also called as the Rotter's node, or also called as interpectoral nodes, which are between the pec major and pec minor. Then the ones which are superiorly and medial to it are called as level 3. So these are the lymph nodes, and mainly the lymphatic drainage of breast is going to be 85% in the axillary lymph nodes and 15% into the internal mammary lymph nodes. So yeah, this is for the basic anatomy of it.